Okay, we're going to talk about a real story. This patient's name is Fred, 70-year-old, having low back pain for a number of months. Went to a doctor. This doctor sent him to a surgeon. The surgeon assessed the situation and recommended a surgery to implant an E-stim unit, in other words, a stimulation unit designed to block the pain. So what happened? The surgery did continue and the implant was put in. The results, negative, it did not work. Actually, the E-stim wires broke, and now there's a second surgery planned.
So the question is, could Fred have avoided back surgery if he would have tried physical therapy first?
My point exactly. Now, after discussion with Fred, my question was, did you have any physical therapy prior to the surgery to see if it could be avoided? The answer was no, to my dismay, of course.
So if Fred had decided to go into physical therapy first, here's what a physical therapist would have checked for.
That's right. Let's take a look at the spine. We're looking at probably two common causes of back pain in this age group. Now, it could be something else, but again, this is typically what can happen. The first thing is possibly a disc problem, and the second thing could be a stenosis. Now, when you get at this age, stenosis does become more prevalent. But first, let's rule out the disc problem. This is also good education for the patient, so they understand what's going on in their body. When you understand it, you feel more comfortable, and chances of success avoidance surgery go way up. Okay, now the big thing that comes up in people's mind is I've got a herniated disc, got a bulging disc, we've got to get it done, taken care of surgically, excuse me. Let's look at this. Here we have this red disc here representing a herniated or bulging disc right here. Now that would be the situation. Now let's talk about bulging discs in this age group. Okay, let's look at the disc and what happens with a disc as we age, particularly 60 and above. Here we have L4, L5. They are vertebrae. This is just a model, a representation. Now, this red ball represents a disc. When you are young, the disc is pliable and flexible. It allows you to bend, twist, and absorb shock through the body. Now, when a disc starts to rupture or herniate, what happens is this. Now remember, the spinal cord goes through here. This is the back of the vertebra. So this is a really dramatic representation when a disc bulges. Boom, it bulges like that. That hurts. That can actually pinch a nerve, causing pain in the back all the way down to the toes. Now, there's one big thing that is really common with elderly people is the disc, the inner fluid that you see allowing this to happen, becomes thicker. It's actually, they describe it like crab meat. So if you are at that age, particularly older, the chances of having a herniated disc actually drop significantly. So sometimes the MRIs show a bulging or herniated disc, and it may have been there for a long time, and it's not the source of the problem. The whole point is, ask the doctor, ask the surgeon to really look at this closely. And sometimes it's nice to get a second opinion. All right, the second scenario is stenosis. We've got lumbar stenosis in the low back where the nerves actually get pinched because the hole, they call it the foramen, actually shrinks. And there's a number of reasons that can happen. Now, if the person presents with pain where they are standing or they walk and pain gets worse, and then when they sit down, very quickly the pain subsides. It's a very strong case that it could be stenosis. Now, there's some more things that a therapist will do to determine that, and we're going to show you some exercises that can also help, which we've had good success with eliminating. So let's go forward and look at those options. All right, now if Fred would have came in and he presented with one-sided back pain and he cleared all the red flags, in other words, I thought therapy may be a good option. This is one exercise that we would try. It's called, well, I call it the door frame stretch. So Mike, go ahead. And the idea is if the pain is on the right side, he's going to actually reach up with his right hand and stretch. Go ahead, Mike. Can you explain it?
So you're going to reach up, touch the top of the door frame, and then I'm going to lean into this side, leaning to my right. Notice how my feet are staying in place, and I'm getting a good stretch in here, opening up and spreading that spine apart, getting relief off of those nerves.
Right. So let's make it clear. You don't have to use a door frame, and if you have door that is not solid, don't use it. It won't be safe. You can use something if you have a pull-up bar or something of that nature where you can safely suspend your weight. Okay, with these exercises, like Mike just demonstrated, and what we're going to continue to show is it needs to feel good while you're doing the exercise, making that pain better as well as afterwards, not just right away, but over the next 24 hours. Then continue as long as positive results. Mike?
So a big red flag is if you're having weakness in your leg that is also coming from your back pain. You're going to want to go see the doctor and get this checked out further, and if they determine physical therapy is appropriate, then give these a try.
All right, let's go on to the next exercise. This is another version if you do not have that door frame to hold on to. Simply take a stick. It needs to be something pretty stout, okay, so it's not too flexible or won't break. Mike is showing it here. He's stretching the right side out. Go ahead, Mike.
So you grab up as high as you can on this pole. I'm going to have my hand and palm facing away from me. I'm going to have a pulling force going down like I would in the door frame, and then I'm going to start leaning the stick away from me like this, getting that nice traction feeling. If this feels good while you're doing it and after, then this is a stretch you want to continue doing.
Just one warning. If your stick does not stick well to the surface of a chair or table, because it doesn't have a rubber grippy thing like the Booyah stick, simply put a shoe down, put it in there, and it really does the job. Okay, another complete option for an exercise is extension in line or prone press-ups. You're going to lie down on your stomach, preferably on a firm, like a carpeted floor. Mike's going to demonstrate here. You imagine that your buttock or your belt line is glued to the floor or the bed, and you simply do a press-up. Notice how it arches the back. You will only do this one if it feels good. Now, the first couple repetitions, if it hurts, but it gets better, clearly gets better by the third one, then you can continue. Now, if it gets worse after the third one and continues to feel like it's not helping you stop, it's not for you. This one typically works with a disc problem. All right, in regards to repetitions, you're not going to do more than 10 at a time. Again, it should feel good or actually make it feel better while you're doing it as well as afterwards. Example, when you get up and walk around. We do have another video that goes into this more detail. If things are going well with it, you can look at that. I encourage you to. Okay, now if these exercises so far have not been helping, this is a good option. This actually works particularly well with most people with stenosis. We're flexing the spine, and Mike's going to demonstrate some very simple exercises that will give quick relief if they're the right ones.
So to perform this exercise, you're going to need to lie on the bed or the floor. You're going to bring one knee up towards your chest like this, keeping the other leg down, and get a nice good stretch. Now, after you hold this for 15 to 30 seconds, perform it on the other leg. See if one side is tighter or if this is helping your back pain. If this is feeling okay, you can progress to bringing both knees up to your chest and just sitting here for a nice 30 seconds and relaxing. The spinal flexion can help relieve that pinching sensation on those nerves that you are experiencing.
Good job, Mike. This would be repeated 2 to 3 times per day as long as relief is experienced. Now, looking at this from Fred's point of view in regards to therapy, now this is what a therapist typically would do. They'd assess all these different options, and both Bob and I have experienced good success with having this back pain relieved. It's just worth it to seek physical therapy versus a surgery, at least 1 or 2 visits.
So if you want to try physical therapy and your doctor didn't prescribe it, simply call them and ask. Most of the times, they'll give you the option.